Good afternoon, everybody. This is Dr. Jeff Gelblum, your friendly card-carrying neurologist, here today to provide you with a Facebook Live update regarding what's in the antibody testing, meaning why is it important that we get our blood tested for COVID antibody? What does it mean if you have a positive antibody? And what does it mean if you don't have a positive antibody? So first off, let's do a quick overview of what we mean by COVID testing. There's basically two types of COVID testing. There's the antigen testing to see if one is acutely infectious. And then there's the, quote, antibody testing to see if one has seen the virus, been exposed to the virus. So recapping very briefly, the antigen testing is a nasal swab. It's an RNA polymerase type of test, and with that we can see if you are actively secreting any viral particles, meaning any aspect of the virus, and that could be the viral capsule, the viral spikes. Remember, it's called coronavirus because of the crown, the spikes that come out of the viral sphere. So basically what the antigen, the nasal swab antigen test is looking for is to see if you have any components of the virus, not necessarily active virus or entire virus, but parts of the virus. So any component of the virus should potentially trigger a positive antigen test. And that means that you are in the active phase of having virus and shedding virus. And of course, at that point, one would be considered to be infectious, or one would consider to be infected and thereby infectious because one can spew out, exhale, sneeze, cough, loudly vocalize viral proteins that could then be infecting another person. Remember, the particles of the virus aren't going to be infectious. You have to transmit the virus in its entirety. It's thought that you have to transmit probably at least 1,000 viral particles in order to communicate the disease. Typically, if it's one or two viral particles, it's not going to be an infectious process. That's why it's very important when we talk about viral load or exposure to people who are infected, that if you can keep your distance and stay away from crowded places, chances are there's less of a viral influx that's attacking your nasal passages, your oral mucosa, your eyes. Those are the points of entry of the virus. And of course, that's why we wash our hands and keep our faces masked. And if you want to wear a shield, that's probably not a bad idea either, because these are the three sites of viral infiltration. So when we talk about the antigen test, we are talking specifically about the virus in its entirety or parts of the virus, the nuclear capsule of the virus, or the little spikes that make up the crown of the coronavirus. So that's what we mean by viral antigen testing. And that's an easy thing to do. The problem, at least in several areas, is it takes a while for that antigen test to come back. So if anybody has been exposed to someone recently infected and you say, oh my heavens, I want to see if I have the virus, well, you can go get that viral test, but it may take 5 working days, meaning a whole week, for it to come back. So at that point, you probably have to quarantine to make sure that you're not infecting anybody else. So that's the problem primarily with the viral antigen test. And then I want to remind you, unless that swab is really shoved up the nose nice and hard, or back of the throat nice and hard, there's no guarantee that you're going to capture a viral particle. So the test is only as good as the person administering the test. And again, if they don't get a good sample of nasal swab or back of the throat swab, it may miss a viral particle. So for infectivity purposes, to see if you're actually infectious or to see if you are in the process of having the virus and shedding viral particles, the antigen test is the way to go. It's a reliable test, assuming that the swab itself is good and that you actually capture some of the actual viral particle. However, I want to remind you that if the technique or the person administering it doesn't actually jam it deep into the nose, you may not actually capture a viral particle. So that's how we define infectivity, ability to communicate the virus, and basically that is called an antigen test. So antigens are how we look at actual infectivity. We can see here in the US that the antigen rate is rising. We've got lots and lots of people who are infected. And remember, it's 5 working days typically for the virus for the test to come back positive, and during that time frame, you could theoretically infect a lot of people. So that's a big issue. Of course, one of the issues also of contact tracing, how to determine if you've sneezed on a group of people and you're actually infectious, then you have to go after those people as well. So contact tracing is a very big issue, because obviously, if you come back positive, we want to make sure that the people that you've been in contact with are also tested. But again, this 5-day delay that we have down here in Florida is somewhat problematic. Hopefully that time frame will be shortened as time goes on and as more labs are picking up, but it's a big issue. The timeliness of the response is imperative for being able to do effective contact tracing and in reining in the viral incidence, the ability to create new viral attacks by virtue of who you're in contact with. So that's the antigen component of the viral test. So now let's move on to the antibody test. What does it mean if you've been infected? Let's say you know you had COVID-19, you had a positive nasal swab test, and for some reason you don't have antibodies. What is that all about? Well, I want to take you into a little bit of the nuts and bolts of what goes into the antibody test. As it stands now in the U.S., and I know we have folks from overseas who are watching us, people in France, UK, and I welcome you. Bienvenue chez nous aujourd'hui. But we know that the antibody test, as is commercially offered at the 2 big commercial labs here in the U.S., Quest and LabCorp, those are the 2 biggies. So when you get a blood test, you're looking at an antibody test. Nasal swab looks at antigen, but when they prick your skin, when they draw out a sample of blood, they're looking at an antibody to see your antibody response to the COVID-19. And a lot of folks are coming back with low antibody levels or no antibody levels. So you scratch your head and you say, wait a second. How can that be? How can I know I've had the infection, my COVID was positive, my COVID antigen was positive, but how is it that I have a negative or a low antibody test? Am I not protected anymore against the COVID virus? And here's what I need you to know. The antibody tests that have been developed have only been developed primarily to look at the N antibody, the nuclear capsule of the virus. The virus is a sphere. Remember, it's a little ball with little spikes coming out of it, hence the name Corona crown. But the antibody tests that have been developed by Roche and Abbott Labs, which are the vendors for the big commercial laboratory areas like Quest and LabCorp, those antibodies look at the nuclear capsid component antibody, meaning your body's ability to create antibodies against that capsule of the virus. It doesn't look for the antibodies that your body is making to look for the little spikes. It's the N that actually is the quickest antibody to rise and fall. It's the spike antibody that is the one that is actually the long-acting one, and in fact it's the spike antibody, which is where all these vaccines are being directed against. So it's kind of astounding that the 2 big lab organizations in the U.S. are testing your antibodies against the capsule, when in actuality it's the spike that probably has the longest duration. So the N antibody rises up, has a quick peak and a high, has a very quick peak, but then comes back down also very quickly. It's the spike antibody, which is the one that probably is the longer acting antibody, and it's that antibody which is not tested by LabCorp or Quest. In fact, that's not the antibody test that was developed by Roche and Abbott Labs, so that's not the antibody test that you're getting back. So therefore, if you are concerned about reinfection where you say, oh my gosh, I got the COVID, it came back positive on the nasal swab, and I just went for my antibody test and it's low, I'm doomed. No, you're really not, because that antibody test is only looking for the capsule protein of the virus. It's not looking for the little spikes that come out of the virus. So therefore, you could very well have lots and lots and lots of spike antibodies floating around in the bloodstream, giving you great protection against reinfection. It's just not coming up on your Quest or LabCorp test, because Quest and LabCorp, the big outfits in the US, are not testing for spike antibody, they're testing for N-nucleocapsid antibody. So because of that specificity of that antibody reagent, of that antibody test, then at that point you are not going to get useful information regarding your immune competence. So you'll say to yourself, oh no, I had the virus and now I don't have any antibodies, so I'm going to get sick again. Not true. Because the antibody test that you're getting is an N antibody, not a spike antibody. And that's the limitation of the lab test. Now, right now, there are no great lab tests for the spike antibody, which to me is absolutely astounding, because it's that spike protein that triggers that spike antibody that is being used to develop all of these vaccinations. So right now, if you are in the business of donating blood and it comes back that you have positive antibodies, that's a great question, Brooke. Do you anticipate that you could donate that blood in hopes of giving protection against COVID virus to another recipient of your blood transfusion? And that answer is probably you would be giving good protection. So the antibody story is a very limited story. And the problem with the antibody story is the antibodies are only telling you about one component of the virus, the present antibody story, when actually I would like a more fuller antibody profile, looking at all the different antibodies that your bloodstream is making directed against the different viral components, but I'm not getting that information. That information is not being presented when I get your lab test back from Quest or LabCorp. The only thing I'm getting is your N antibody level, either IgM or IgG, meaning short-term, long-term, but I'm only getting it against one component of the virus. And that component typically goes up real quick and comes down real quick. So if I want to get a level of your spike antibodies, which is probably the more powerful immune-conferring antibody, if I want that information, I'm out of luck. I can't get that information because that's not the information that's coming back to me from the commercial lab that your insurance pays for. So therefore, I don't want people to freak out if you have a low COVID antibody level, because the antibody is not geared against the entire COVID virus. It's only geared against the capsule of the virus, but it has nothing to do with the little spikes that come out of the virus. Now, you want to show me a level of a spike antibody, and I will guarantee you that that is going to be much greater than the N capsule antibody. So, recapping, I'm telling you what goes in to the coronavirus structure. It's got spikes, it's got a capsule, it's got lots of RNA on the inside, but the antibody tests that you're getting are only telling about the capsule. It's not giving you information about any of the other viral components. So if that specific antibody is low, you're still going to have protection against the COVID virus because there's other parts of that virus that are going to trigger a good immune response. So do not despair if you have a low antibody level because it's only looking for one part of the coronavirus, which is a very small part, possibly an inconsequential part, and certainly not a part that is being used to develop the vaccine. So you want to talk about spike antibodies? I'd like to see that level. Unfortunately, I'm not going to because nobody's giving me that information as a doctor. But I can tell you that's an important piece of information to have because that's a piece of information that can say, hey, Brooks has still got antibody prevalence against coronavirus. Yahoo, Brooks, you're protected. So this is all very, very important information for us to know. So I want you to understand what goes behind the lab tests that you get. Again, your antigen test is only going to be as good as the person giving it and sticking that thing up the nose. The antibody test is only going to give you an encapsular result. It's not going to tell you anything about all the other viral particles that are floating around in your body ready to trigger a great immune response. So I don't want you to freak out if you get a low antibody level, and I don't want people to think, oh my goodness, antibody level went to 0, I had the infection, and now I'm going to get the infection again. No, because that antibody level, in many respects, is a red herring, looking at only one component of the virus when there are other components of the virus. It's like my grandmother's cheesecake recipe. You thought you were getting the whole thing. Well, you weren't getting the whole thing, and that's why my cheesecake never tastes as good as my grandmother's did, because she would never give out the whole recipe. And it's the same thing with the antibody testing. It's only giving you a part of the story, and it's not giving you the whole story by which your body sees the virus and can mount a follow-up response to another viral attack should it come back. Meaning, should you be exposed again, are you going to be immune? And I would venture to say yes. And the reason why I say that is because, as we all know, when it comes to generating an immune response, there's two major cells in the bloodstream. There's the B cells, which make antibody, and then there's the T cells, which offer a cellular response to attack. So let's break that up very quickly. Why are they called B cells? Well, believe it or not, it has nothing to do with blood. It has to do with bursa. And B comes from a chicken bursa because many years ago, the original investigators looking at lymphocytes said, oh, there's a lot of these cells in the chicken of a bursa, in the bursa of a chicken that make antibodies. So B cell stands for bursa of Fabricius, which is a chicken bursa, which is a source of antibody production in chickens. It just so happens that we have the same type of response in antibody, and that's why they're called B cells, because the B cells make those antibodies. That's what we mean by humoral immunity. And then the T cells are thymus-derived. Here's your thymus gland right up here, secondary immune organ like the spleen. And what happens is when we see an infection, your B cells start to pump out antibodies against spike protein, against capsule protein, possibly against the RNA that's inside the coronavirus. So it pumps out antibodies against all components of the coronavirus, even though we're only seeing part of that in the blood test. But the T cells are always lying dormant. They're always in the body, in surveillance. They're in your spleen. They're in your thymus gland. And at the moment of a viral attack or a viral reattack, those T cells mobilize. They've been lying, waiting in the wings, in the background, in your spleen and in your thymus. But the moment that infection represents again, the memory of the T cells then go on the attack like Pac-Man, like scrubbing bubbles, just attacking that virus. So remember, immune competence, the ability to fight off an infection, is not just about humoral antibody immune competence, but it's also about the T cells. So obviously, Mary, you're going to ask me, well, how do I get my T cells checked for immune competence against coronavirus? Well, you can't, Mary. There is no test for that commercially available right now. But trust me when I tell you, it's this fine interplay between B cells and T cells, where the T cells trigger the B cells to go on the offensive. It's kind of like the T cells are in the back waiting for the sound of the alarm, and then boom, they shoot out. And a question you need to ask is, well, how long does it take a T cell response to occur? Meaning, all right, I've had coronavirus. Dr. Gelblum is telling me my antibodies are low, but not to worry because I'm only looking at one type of antibody, and I probably have other antibodies that'll pick up the same viral attack. How long is that going to take to mount a second attack if my antibodies are low? Well, we believe that T cell responses can occur in a matter of hours. So therefore, if you've had COVID, you've been tested, the nasal swab came back positive, you're recovered, you're back to work, you've gotten an antibody level, and your boss asks you, hey, what's your antibody level? Even though they can't ask you that because it's probably against employment guidelines. But you say, hey, my antibodies are okay, not great, not bad. And then the boss says, well, does that mean you're really immune competent? Does that mean you can fight off the virus? And the answer is probably you'll do a great job of fighting off the virus because you've got this repository of T cells, which literally within 2 hours can go and stimulate more B cells to make antibodies to ward off a new infection, to attack a new infection. So we do believe that the T cells are entrained now, Daniel, to respond to your specific question. We do believe that there is good T cell entrainment by the attack of the COVID. In fact, I will tell you that these cytokine storms that you all worry about in the ICU, patients having all of these systemic collapses due to severe coronavirus, that may be due to hyper response of T cells to hyper activity of the T cells. And in fact, there are several drugs being developed. Robert, I know you're interested in one of those drugs. There are several drugs being developed now that can dampen down that T cell response so it doesn't become as aggressive. We neurologists have been playing around with T cells forever. It's how we treat MS. So T cell manipulation, T cell adjustment is nothing new to immunology and is nothing new to pharmacology. And this is why we are developing better and better treatments for really sick people with coronavirus, because we can intervene to somehow modulate that aggressive T cell response, how it interfaces with the B cells, and how it then secretes all sorts of other cells to come in and clean up the coronavirus infection in your bloodstream. So, for purposes of recap, coronavirus hits. You get a nasal swab, it comes back positive. Okay, now you know you have coronavirus. And I will tell you, the vast majority of people are going to do just fine. It's the older folks with other metabolic comorbidities, such as diabetes and high blood pressure and obesity, that do poorly. But 99% of all of you watching today are going to do just fine, God forbid, if you get the coronavirus infection. So then what happens is your test comes back positive. Okay, I've had coronavirus. I'm feeling a little crappy, but I'll get over it. And then you say to yourself, well, let me go for the antibody test because I want to see how my antibodies are. Antibody test comes back, meh, nothing great. And you say to yourself, damn, I thought I had a more robust immune response. Well, in actuality, you probably do have a very robust immune response. Why? Because they're only looking for the antibody to the nucleocapsid protein. It's like if you wanted to describe my face, the only thing you're going to see is my head. You're not going to see my ears, my receding hairline, which is far more than receding, is gone, beard, anything else. You're not going to see anything else. It's just the shape of the head. But remember, there's a whole bunch of other antibodies, billions of antibodies, floating around in the bloodstream that are ready to attack at a moment's notice should this head now come back and attack. And then, of course, beyond that antibody status is the T cell component, the thymus-derived cellular component, which is constantly being surveilled, which is constantly actually surveilling to see if that virus comes back. So how does it surveil? Where are the T cells? Well, the T cells are in the bloodstream, but I said earlier today, remember, the bulk of them reside in the secondary lymph organs, thymus, which is where we get the name T cell, and spleen. So that's why it's very important that you drink lots of fluids all the time, because the way viral particles are delivered to the spleen and to the lymphatic system is by drainage, lymphatic drainage. There's actually no lymphatic pumps going on. They're microscopic pumps. And the thing that keeps your lymphatic system flowing and going is good hydration, high fluid intake. And that's why, living here in Florida, I tell all of my patients, you got to drink 8 glasses of water a day at least, but more so in the presence of preventing an infection or fighting an infection, lots and lots of fluids. It's like your grandma used to say, drink up lots of hot tea, orange juice, chicken soup. Why? Because it's that fluid load that drives the lymphatic system, delivering those viral particles to the T cells, which can then work their magic to bind up and destroy the active infection, the active virus, the bacteria, whatever you want to be infected with. For purposes of COVID, we're talking about a virus. So therefore, adequate hydration, abundant hydration, is the hydraulic pump that keeps the lymphatic system going so that your T cells can always surveil, can always make sure that they're able to attack a virus as it comes through. And then other things that you can do to boost your immune T cell competence is always maintaining a good vitamin D level, making sure that your vaccinations are up to date, so your T cell subsets, all of your population stays active and attentive, and then making sure that you get plenty of sleep and all of that. So in summary, purpose of today's discussion is to say, don't despair if your antibody levels are low, because we're only looking at one antibody when there are many antibodies involved in the attack of the COVID virus in the body. And then please remember that you've got this active, enormous population, billions and billions of not only B lymphocytes and T lymphocytes that are surveilling, traveling through the bloodstream every day, looking for another COVID virus. And the moment that that attacks, boom, they spring into action, because the T cells now have the memory where they can say, oh, I've seen that one before, attack. So with that, I hope that I've given you good advice with regard to not only maintaining good immune status, but to understand exactly what's going into the lab tests that you get back from your doctor, someone like me. And hopefully that doctor is saying, hey, Robin, yes, you had the COVID. Your antibodies aren't so great, but do not despair, because it's only looking at one antibody. You've got probably several other antibodies that are active and not being looked at with this test. And then, of course, we've got our T cells, and we're not presently running, no one is running memory-based T cell assays to see what your T cell status is directed against the COVID-19. But they're there, trust me. Now, final point is for folks who are immune compromised, meaning anybody with lymphoma or anybody receiving chemotherapy, obviously that is a special needs high-risk population, because if your T cells are suppressed, then obviously you may not have the memory to go after that COVID virus if it comes once again. And that is why for my patients who are typically on immunosuppressant treatment, cancer, multiple sclerosis, myasthenia gravis, those patients who are on immunosuppressant treatment, and there are lots of treatments that aren't immunosuppressant, but for those who are on immunosuppressant treatment, it's very important that we discuss with those patients the need for extra special care with regard to original COVID infection and then the possibility of reinfection. So, antibodies, meh. The ones you have, the ones that are being tested, maybe it's useful, maybe it's not, but make no mistake, your body is full of antibodies that can attack various components of the COVID virus. And as I said before, The vaccines that are being developed are going against the spikes. That's not even being tested in the blood test that you get back. The only thing that's being tested is the nuclear capsid, the cranium, but nothing that goes on the cranium. So with that, you take the information with a grain of salt, and a grain of salt, and rest assured that your antibody status, which is composed of multiple antibodies, will be adequate to respond to another infection in conjunction with your healthy T cell repository. There should be no problems. And that's why when we talk about remembrance of immunology, or the ability to remember if the infection has occurred, the persistence of immune competence, chances are once you've gotten that infection, there is very, very little chance that you're going to be reinfected. So we've covered a lot of information in a short period of time. I look forward to offering you televisit consultation should you need, remembering that I'm a neurologist. So I don't want to hear about your gastric reflux or your toenail fungus. But aside from that, I really appreciate your coming on today. There's a lot of misinformation in the news, a lot of anecdotal stuff being pumped out literally on a daily basis on social media. And I'm grateful that I had the opportunity to share some useful information with you today. If you look at my Facebook post from yesterday, there's an excellent review article that was uploaded that can take you through more of the details of what we discussed this afternoon. So again, I thank you for your participation, and I look forward to seeing you again real soon. Thanks for logging on. Have a great afternoon, everybody. Happy Monday. Bye-bye.